Hello again and welcome to the Dr. Hilary Show. Coming up, a man who gave up a career in law for a life in politics, serving as an MP in South London for 11 years before he stood successfully to be Mayor of London. Now, in his third term, we'll be talking about air pollution and what needs to happen next with the NHS. And we'll discuss his own health and well-being with Sir Sadiq Khan. First, today, what answers do you need about your health, those worries that just won't go away? This is your chance to get some help with Ask Dr. Hilary, where each week I'll answer your health and wellness questions right here on the show. If there's something on your mind, let me know. Just send your questions to ask@drhilaryjones.com. Don't wait, get involved, and let's talk about what really matters to you. Now, my guest this week has been the Mayor of London since 2016, when he became the first Muslim mayor of a major Western capital. A former human rights lawyer and MP for Tooting, Sir Sadiq Khan has focused on tackling London's housing crisis, improving public transport and making the city greener. Under his leadership, improving respiratory health with initiatives like the Ultra Low Emission Zone, the ULEZ, has been a major priority. To discuss that and much more, welcome Sadiq Khan.
It's a pleasure to finally be asked to be on your podcast.
Well, no, it's a privilege to have you here, and I've got lots to ask you about. Great. We're going to ask you particularly about the news last week, the report about the ULEZ that has been talked about so much since then. Also about your stress levels, because your responsibilities are huge, looking after so much for the entirety of London. And also, I think we could touch on any personal health journey that you've had and how you think the NHS is faring at the moment. But let's just look, first of all, at the ULEZ report. It was really very favourable. I'll let you talk about the details, but the expansion of ULEZ has resulted in all Londoners breathing much more high-quality air than was the case even a year or two ago. And some of the stats are very good. I mean, the nitrogen dioxide emissions, for example, 27% less across London. So these are the things that cause asthma and lung conditions and contribute to chronic obstructive airways disease. You must be very pleased by this report.
Yeah, well, it's great. It's great being on your podcast. Look, if I'm honest, I discovered the consequences of air pollution very late in the day. And I've got to be honest, I'm somebody who, was a lawyer for many years, was interested in politics. I was a member of parliament. I was being a minister and so forth. I never knew that this thing you can't see causes all sorts of problems. And I've got to be honest, my journey was a selfish journey. In 2014, I ran the London Marathon. And before then, I'd had a full medical. I was fit and healthy, no issues at all. But a few months later, I started to notice that I was having problems when I was doing exercise in terms of my breathing. I was clearing my throat a lot. At night time, I had challenges. And I went to my GP and she referred me to a specialist. And I was diagnosed with adult onset asthma.
Right.
And I then discovered that actually the explanation for this was probably because I'd been running the streets of London on a daily basis for many weeks and many months next to polluting roads. I was breathing in this stuff. You can't see it. You can't see nitrogen dioxide, nitrogen oxides, particular matter 2.5, PM10. And what it is you'll know that the medical journey, but it can lead to a whole host of respiratory issues, asthma. It's also linked, by the way, to premature deaths, to lung cancer, to heart disease, to strokes. It can increase the likelihood of dementia. I had no idea. And then, coincidentally, I discovered the story of this 9-year-old child called Ella Adu Kisi Deborah, who lived up the road from me by the South Circular. And I read, because Ella passed away from one of the many asthma attacks she had. And Rosamond, her amazing mum, had no idea until afterwards. You can draw a graph between Ella's asthma attacks and traffic congestion outside her home in the South Circular. She campaigned for this inquest, and the coroner concluded that air quality was a factor in her death. So that began my learning about this, and me then asking the question, Hilary, look, if we cause air pollution, in other words, mainly transport, can we reverse it? And, I looked at what the policies other cities and countries were doing, and there wasn't much around. And, we discovered this policy called a clean air zone. So the main cause of this pollution is older vehicles, basically, the exhaust pipes. So can you, using the polluter pays principle, having carrots and sticks, clean up the air in London? And as you said, I'm incredibly proud. It's been a tough journey. It wasn't easy. But the evidence shows, and the experts from Germany, France, Belgium, Imperial and York have looked at data over a year, a reduction across all of London of 27% of nitrogen dioxide, a reduction across all of London of 36% nitrogen oxides, and a reduction in outer London of 31% PM 2.5. 99% of the air quality monitors have shown the air quality in London has improved. And here's the lovely thing for me, is the air in London is improving much faster than the rest of the country.
Yeah, it's very impressive. And you mentioned the Ella Roberta Foundation there. They're just one of your plaudits. You've had plaudits from the WHO, from Mums for Lungs, Global Action Plan, Clear Air Fund and Asthma and Lung UK. They're all very impressed by the results that you've had. But of course...
Hilary, I've got to just talk about one thing, and you'll know this as a practitioner, but, one of the things I encourage your listeners to do is you can just Google it, because you can't just go there. But if you ever go to Great Ormond Street or to the Evelina Children's Hospital, there are 2 hospitals in London, on these wards there are kids who have problems breathing, and it's linked with the air that you can't see. And so the plaudits are great, but it's actually the real tangible difference is hopefully fewer premature deaths and fewer people suffering, as we know they have.
Absolutely. And you're quite right by saying this is invisible. People can't really see the pollution, so they think it doesn't exist. It's not like the Industrial Revolution where you could see the smog. You could see, you could see all that. This is a different kind of pollution, but you can only see it when you wash your hair, if you've got more hair than I have. You see it at the bottom of the shower. If you blow your nose, if you've been out in London, you'll see the dust and the particles. That's the only time you see it. But of course, the results that you've had come with criticism. That people want to drive their 4x4s in London. They don't want their convenience has been shattered by this. People will say, but I've had to sell my older vehicle at some cost to myself. How do you deal with that criticism?
Well, look, firstly, I'll address that point head on. But if you look at history and public health improvements, they've all come with challenges. You talked about the Great Smog. Well, actually, 100 years before that, we had the open sewers. And Bazalgette, this remarkable engineer, built the Victorian sewers, right? The death there was in the Victorian times in the 1950s. The Conservative government said, hold on a sec, this great smog is caused by these factories in Battersea Power Station, what is now the Tate Modern. Let's close these factories down and move them outside of the city. Smoking. We were talking 60 years ago, we'd be having a debate about whether tobacco causes all sorts of ill health. The problem with air quality is spot on. You can't see it. So it's difficult to explain rationally why this stuff is a problem, but also nobody wants to be inconvenienced. You remember when we first introduced banning in public places of smoking?
Lots of resistance.
I can't smoke in my pub. I've got to go outside and so forth. You wouldn't dream now of smoking at a gig or on the tube. So I recognise the challenges. So we had to have a combination of carrots and sticks. So the first thing is, this is not an anti-motorist policy. I'm not anti-car. I love driving. The issue is anti-poison. And you may not realise it, but if you're driving a non-compliant vehicle, an older diesel or an older petrol, you as the driver are breathing in this poison. Your kids in the back, they're breathing in the poison. If you've got an older parent next to you, he or she's breathing in the poison, and those around you are as well. So what we did from City Hall is give support financially in terms of a scrappage scheme to make it easy as possible for a small business, for a charity, for a family to transition. And the great news is our scrappage fund helped support almost 200,000 vehicles off the streets. So when I began this journey, in London, there were only 39% of vehicles compliant. It's now 97% of vehicles are compliant. There were only 12% of vans compliant. It's now 90% of vans that are compliant. So we're not making money from this because if your vehicle's compliant, you don't pay a penny more and you get the benefits of clean air. So, it has been important to take people with us. And the way we've done it, if I'm honest, Hilary, is incrementally. So we began it in central London. There was initial opposition. We showed it worked. We then moved to inner London, more boroughs involved. We showed it worked. Then we moved to all of London. And the research published last week is a year's worth of analysis of these various monitors across London, and we can see it works.
Yep. No, I mustn't be accused of praising you too highly.
Sure.
So there's always a big criticism. But you're responsible for, the bus network, the underground cycling policies, and you've made the public transport more accessible to people and cheaper than it used to be. But it's also true to say, isn't it, that 585,000 people who suffer from asthma and lung diseases are better off now because of ULEZ than they were, and you've protected people who live near busy roads in deprived areas who were most at risk. So that's all laudable. Cycle lanes, a bit of an issue for many drivers. Maybe they're saying there are too many of them. They're not used enough. What would you say to that?
Let's deal with that issue. Well, firstly, look, we're a city that is now a city 9.7 million. And that's before you include people coming every day, working and so forth. Now, we're no longer a Roman village. So if everybody jumps in a car, there's a problem. And so what we've got to do is make it easier for people to have alternatives to using their cars where possible. Some people clearly got to use their car or their van, or a plumber, electrician or whatever. So easier to walk, wider pavements, easier to cycle. We're making it safer. We've increased fourfold the amount of cycle network. Why? Because cyclists are fine when they're confident, but often you're not confident because you're worried about being run over. We've also, as you've said, frozen tube and train fares in 5 of the last 8 years, bus and tram fares in 6 of the last 8 years to make it more affordable. But also, you and I both know, actually, because of our consumer habits, we're ordering stuff at home. These delivery vans come and drop off at our home. This finite space we have is leading to congestion because too many people are using it. So we've got to think about how, as a city grows more, nothing wrong with grow, got to plan for the growth. We have attractive alternatives to driving, and that means cycling, walking, using public transport. And the joy of cycling and walking is great for your health.
Makes you fitter as well.
It's a win-win.
Absolutely. I want to ask you about other health initiatives that you've had over the years, particularly during COVID, because I think you were quite keen on people wearing masks, particularly on the tubes, and you wanted to introduce a lockdown earlier than it came, and you've been proven right on that as well. I was with you on that. So your public health initiatives are based on, what is right for the population of London, but of course they're not always popular.
So I used to be a lawyer, and so I'm obsessed by evidence. I also got certain values as well. And so when the pandemic had begun, actually, we knew it was in Italy. We knew it was taking place in China. I was speaking to colleagues in Italy and South Korea and China. And so my frustration at the British government's response to the pandemic was we weren't learning the lessons to those countries where it had begun. And so we knew social distancing would make a difference because I'm catching the virus because I'm next to you, right? We also knew that wearing a face mask, even if it's not clinical, will stop me giving you the lurgies, right? It may not stop you catching it, unless you're wearing a clinical mark of a certain standard. And you can even have a DIY mask. And I got this from an Oxbridge expert was telling me this. And there are other examples. I was pleading with Boris Johnson to close down the pubs. It was ridiculous having, racing taking place and gigs taking place and sporting events taking place.
We remember.
The tube is ostensibly safe, but if you're standing under my armpit, it's not safe, right? Next to each other and so forth. Yeah. And it was frustrating because the evidence was there, but because, the government was nervous about public opinion, they moved late. And you and I know it was the initial transmissions that was catastrophic. And what broke my heart, Hilary, is, look, my dad is passed now, but he was a bus driver. And I used to every day I'd ask for a list of the names of everyone who'd lost their lives in London, key workers. I'd try and write to them when I could. And it was noteworthy. These bus drivers, these shop workers, people who were going to work to keep our city running were losing their lives ostensibly because of that transmission in February, March and April. And I think had the government moved swifter then and listened to the evidence then, we wouldn't have had what we have now, which is 5 years on, Hilary, and it upsets me to talk about it. In our country, 200,000 people lost their lives because of this awful pandemic. In London alone, 19,000. And many of us, I'm sure, lost family and friends.
I think people forget how devastating it was to begin with. I've just been to the COVID memorial service, which celebrates some of the NHS heroes that lost their lives to looking after people with COVID. And you were right that the mask issue polarized opinion. And what struck me most about the pandemic was the lack of knowledge, the lack of understanding, the lack of trust in the medical profession, in science, and people just carrying on as if there was no pandemic at all. It was of concern.
I think the problem is there is this view, inverted commas, experts don't matter. People go to Dr. Google or consultant YouTube. And if I got a toothache, I go to a dentist. If I got a problem with my health, I go to my GP. If my car's broken, I go to a mechanic. And the problem is you have these non-experts proselytizing and giving the impression they know best or the experts are wrong. I'll give you a classic example. So you remember we've because of the hard work of some amazing scientists, we very soon had a vaccine. But in some communities, there was hesitancy about having the vaccine. So if you're from a minority background, you're suspicious about pharmaceutical, right? Because of your country of origin and what pharmaceuticals did there. Not unreasonably, by the way.
No, absolutely.
Some members of the public are suspicious of politicians, right? So what we had to do in London was speak to people who were trusted, and we did some research. GPs, everyone trusts their GP, right? So we got GPs to encourage their patients to get the vaccine. We also recognised that faith leaders and community leaders are respected, and indeed some celebrities. So we had to use the different tools we had to address the issue of, inverted commas, vaccine hesitancy, because you will know the importance of that vaccine in relation to getting our city bouncing back.
Absolutely. Your personal job, I mean, you mentioned the fact that you talked about dentists there, and I know that for a while you wanted to be a dentist, but your school teachers saw that you had a penchant for argumentativeness. They thought you'd make a good lawyer.
So I did biology, chemistry, maths A-levels because I was destined to be the world's finest dentist in my dreams. And there's two things happened during my sixth form. One is there was a great program on TV called LA Law. I wanted to be Cusack for those of us that memory of Fuentes. But secondly, my maths teacher, Mr. Brown, he said, I can remember the day in the conversation he said, Sadiq, you're always arguing and you're so good at it. Why don't you be a lawyer? And teachers have this, I've had great teachers, and I'm sure had great teachers, Hilary, but they can have this transformative impact on you. I was blessed with great teachers. And Mr. Brown, when he said that, I thought, actually, I do enjoy debate and discourse. And I've got 7 siblings. We have, argue friendly way all the time, right?
Yes. And
actually, do I really want to spend the next 40 years looking in people's mouths? And I love my dentist, Dr. Shah, he's a great guy. But, so maybe less stress.
It wasn't for you.
But not for me. The great thing about this city of ours, London, and our country is the opportunity. If you work hard, there's a helping hand, you can achieve anything. Look, my grandparents were immigrants from India to Pakistan because of the partition. We're Muslim. My parents migrated from Pakistan to London. And my dad always used to say, and my mum still says it, that actually this city gave our family the opportunity to fulfill their potential. The deal was, though, as you work hard, there's a helping hand. And my frustration is, Hilary, there are too many Londoners working hard, but there's no helping hand. And that leads to grievances, that leads to unhappiness, that leads to people thinking, well, it's not right that I'm doing the right things, I'm not getting decent housing, decent healthcare, decent education for my kids. And that's one of my missions as the mayor, is to be that helping hand to ensure other Londoners can be as lucky as I was in relation to the life chances I had. Great youth workers, great school, great teachers, a grant to go to university, council housing when I was growing up, great mentors when I became a lawyer, encouragement to become a member of parliament in my community. And I'm still blessed today with great mentors and great teachers. And I think it's really important to have aspiration and ambition.
Absolutely. And you've achieved many, many things, and you were knighted this year. Congratulations with that. But with that success comes criticism. I know that despite the ULEZ favourable report, you've got criticism for that, but you get criticism from all sides. You as a practicing Muslim, you get criticised by some of your faith for being too westernised. You're criticised by Trump personally because of the spats you've had on Twitter with him. So you're getting it from all sides. I know you've had death threats as well. And I've had one or two during COVID. How do you deal with that stress? And I know that in a recent article you've said you suffered from PTSD. You talked to a friend of yours who's a doctor about that. How do you deal with it?
Well, in whatever walk of life you're in, you often experience stress. There's a couple of things I've learned. The older I get, I've learned is actually we talk about fitness. We assume it means physical fitness, but we should also talk about mental fitness. Mm-hmm. Because fitness, I think there's two sides to the equation, physical and mental. I didn't realise this until the pandemic, actually. I knew about physical fitness. Obviously, do exercise, eat healthily, keep fit. What I didn't realise until the pandemic, when I stopped doing certain things, I didn't realise that actually doing those things was keeping me mentally fit. Do you see what I mean?
Yes.
And so going out with my mates, playing team sports, going to the cinema, those sorts of things I didn't realise was really important for mental fitness that avoided mental ill health. Does that make sense?
Yes.
Because we know about physical fitness and what we're going to do to avoid physical ill health. And, one of my best friends is a doctor, he's a GP. And I still, every weekend on a Saturday, play tennis with him. It's physical fitness, but we talk. And one of the big problems with our gender, our sex, is we don't talk about our feelings, Hilary.
Yeah.
We don't. We'll talk about football, politics, music, never about our families or how we're doing, how we're feeling. And so a trick another friend, actually Alice Campbell, taught me is when you ask somebody, how are you? They'll say, reflex, I'm fine. Say,
yeah.
No, actually, how are you? Do you see what I mean? Because it's often the second time where even a mate may actually answer. It's different for you because you're a doctor. People are honest, sometimes too honest, I suspect. But not everyone has got a friend who's a doctor. And so it is really important to sort of make sure you're looking after yourself.
Ask that second question, how are you really?
Do you know what I mean? Because you will know the biggest cause of death for men of a certain age is suicide, right? Because we don't talk about how we're feeling. Then it gets too much. And so fortunately, I've never reached that place. Yeah. But, my job, obviously is a very stressful job, it's a 24/7 job. But I'm blessed. I've got a great family, a great home, great friends. The people I work with, I adore and love, and it's, I think, reciprocal. I've got a great team around me, and I love what I do. So I don't need sympathy, people feeling sorry for me, but it is really important to look after yourself. And there's always somebody you can talk to, Hilary. That's the other thing. No matter what job you've got, whether you're the Prime Minister, the Mayor, one of our country's leading doctors, whatever you are, there is somebody out there who can give you advice.
And most people are pleased to do it, aren't they? They're pleased to be approached, and they'll have an own story that they can share, and sharing is half the battle.
There's a great story somebody once told me. It's from a program, but where somebody falls into a hole, and his friend's walking past, and he says, "What happened to you?" He goes, "I've fallen into a hole," and his friend jumps down to the hole and says, "Why have you done that for?" He goes, "Well, I've been here, now I have to get out."
Okay.
And so it's important to realise actually many of the experiences you have. Yes. Somebody else has had as well. Yeah.
I was going to ask you how you keep fit, because you're trim. You're obviously very trim. And I know you're on Ramadan at the moment, so you're not eating or drinking until this evening. So that's hard to do. But I know that you faced racial discrimination in the past, even as a kid. And you took up boxing for a while to look after yourself. How long did that last?
This is a true story. So Frank Bruno, a former world champion, went to the same gym as me.
Did he?
I never boxed him. He's a bit bigger than
He's a bit bigger than you, isn't he?
So the story is, one of my eldest brothers, Zaid, keen boxer, and so we lived on an estate, and frankly, if you weren't doing something constructive or sensible, you'd get up to mischief. So Zaid first went to the boxing club, and then all of our brothers went. I've got 6 brothers and a sister. And it kept us out of mischief, if I'm honest. It kept us out of trouble, but also it taught us life skills, how to keep fit, how to box, of course, diet, how to be magnanimous in victory, supporting your mates on, how to be dignified in defeat, kept us off the streets. And actually, some of my greatest mentors have been youth workers, my boxing coaches, cricket coaches, football coaches. And that's why, as the mayor, I've invested a huge amount in youth clubs, after-school clubs, youth workers, because, austerity has meant a number of things. We can talk about the NHS or policing or housing, but actually youth clubs and youth work is so important. Crime isn't inevitable, it's preventable. But also, although not all of us will be an elite boxer or an elite footballer or an elite tennis player, it's a life skill, because you can keep on doing that sport to an old age and stay fit. So I now every weekend still play tennis, play football, I jog. We've recently, my wife and I, invested in a Peloton machine because it's enjoyable and it's fun, and the endorphins kick in. But also, as you said, it keeps you physically and mentally fit.
You're quite competitive? Must have been with seven brothers.
I'm still now, So we play football every Sunday. The same mates we started playing 30 years ago. Just, one of our friends turned 70 this weekend, a bit older than me, but we still play. We've got new rules now: no sliding tackles, because we're at a certain age now. So
yes. Takes longer to recover from injury.
But we still have arguments. It's quite fascinating. These are grown professionals, right?
Yeah.
Monday to Friday, you wouldn't believe the jobs
your kids again.
that we do.
No, absolutely.
Kids again.
Yeah, just like my brothers. I've got three brothers.
And the joy is, there's no airs and graces, because on a sports pitch or a tennis court or in the ring, you're all equal, aren't you?
Yeah. So you talk about sport being a great sort of way to be mentored, and you talk about youth workers and youth clubs, and I agree with you. Where would you stand on military service that's being discussed at the moment?
Look, I think it is important to encourage young people to volunteer. Military service isn't a way. I think there is something to be said about what used to be called in our day the territorial army. Mm-hmm. I've got friends who are sign up, and it's great for them, the life skills they learn. But also, if and when we need additional resources, the TA, the voluntary army are there. I think the problem with military service is not just the connotations, but also actually we've got to get to a situation where we aspire for people to be good citizens. What I'd rather do is in our primary and secondary schools teach about citizenship. Almost have a rite of passage. So I want actually there to be voting booths inside sixth form colleges and schools. So when you get to be 18, you can make it easy to vote. So we become active citizens and get involved in our community. So, many of my siblings now volunteer, whether it's the swimming club, the boxing club, or whatever it is. And that's, I think, how we give back, rather than forcing somebody for X period of time to do military service.
Yeah, because some people are advocating this to actually give young people discipline. If we look at one of the major responsibilities that you have is policing and crime, and since 2016, I think violent crime's gone up about 30%, and knife crime by 20%. I went up with the London Air Ambulance a couple of times, and their major cause of a call out now is a stabbing, and these are just the bad ones that we hear about, not the less serious ones. So what can we do to improve this?
Firstly, anyone listening, please donate to the ambulance service. They're fantastic.
Incredible, absolutely incredible.
This is an organisation,
and it's all charitable.
It's all charitable. It's remarkable the work they do, and what it is actually, you all know this, but your listeners may not. As soon as possible, getting to the injury can save lives, and there's these amazing packs they've got, and they save lives. So let me deal with the issue you raise about violent crime and knife crime in particular. So we have seen since 2012 an increase in serious youth violence, an increase in knife crime, but also the sorts of knives being used, machetes, combat knives and so forth, that they're glamorized from social media and Hollywood movies. So since 2016, in the context of massive cuts from central government, the Met Police Service has lost £1.1 billion from central government cuts, about a third of our budget. We've had in London 130 youth clubs closed down, 700 youth workers losing their jobs. In City Hall, we've got a mantra: toughen crime, toughen the causes of crime. Toughen crime means we support the police. Support the police in relation to investing in more police officers, but also using the powers they have to take offensive weapons off our streets. Strong neighbourhood teams, the Bobby back on the beat. Knowing who your police officer is, to give them intelligence, who's a troublemaker, who's carrying a knife, who's carrying a gun. At the same time, being tough on the causes of crime, invested in youth clubs, youth workers, after-school clubs. Because if we can, divert a young person away from a criminal gang or crime towards tennis, football, music, artwork, that is a life probably saved. So the good news, in the last few years since I became mayor, not only the number of young people injured with a knife under 25 going down, homicides going down, but last year we had the lowest number of teenage homicides in more than 11 years, and the fewest number of those below the age of 25 killed in more than 20 years. And it's ostensibly diverting young people away from a life of crime, picking up a knife, to constructive things. My fear, though, is this, Hilary. Many young people think carrying a knife makes them more safe. And all the evidence is if you carry a knife, you'll be less safe. And so I say to any parents or uncle and aunties listening, if somebody in your home is leaving the home with a knife and you can't stop them, honestly, you're probably saving their lives by ringing the police, because that young person carrying a knife is risking their own personal well-being, but also that of other young people as well.
Yeah. So we touched on mental well-being, and of course the crime rate is often seems worse than it is because of the constant notifications that we get on social media. Every single stabbing that is serious is, we see it straight away.
Let me reassure your listeners. So the perception of crime is a big issue, and in that way, without in any way, trivialising crime. I meet victims of crime too often, both as a member of Parliament for 11 years and the mayor for the last 8 years. It's awful when you meet a victim of crime or a bereaved family. But to reassure your listeners, so when you look at homicide figures in London compared to New York, Chicago, LA, Paris, Madrid, Barcelona, Toronto, Berlin, it's less in London than those cities. According to the ONS, the Office for National Statistics, you are less likely to be the victim of violence in London than the rest of the country, less likely to be injured by violence in London than the rest of the country. But obviously, and I'm not criticising the media. If it bleeds, it leads. So it becomes newsworthy for obvious reasons. But also, we're not unreasonably are worried about being a victim of crime because we may have heard about something from the radio or the TV or social media. So I completely understand people's nervousness and perception. But just to reassure your listeners, we're a safe country, relatively speaking.
Doom scrolling is not a good idea. It's not good for us. So one of my final questions, we talked about your own personal health, and you've had nothing serious in your life, I don't think.
No, I minor health scare a few years ago where we thought I was having a heart attack, but I wasn't, thankfully.
Good.
And so I was checked out and stuff, and I'm fine.
Good. What about the NHS, though? The health of the NHS? Do you have much involvement in looking after it? And, it's cherished, it's loved, but it's on its knees.
Look, we've got to be really careful about, thinking that the NHS is going to suddenly bounce back without some serious surgery. So the current Health and Social Care Secretary is, I think, one of the best we've had, a guy called Wes Streeton. And I think he's starting to diagnose the problems with the NHS, and he's got a prognosis. And some of it is, medicine that some people won't like. Firstly, I think we do need a huge amount of investment in the NHS. It's been grossly under-resourced for many years. You'll remember, Hilary, in 2010, waiting lists at a record low in the NHS, patient satisfaction record high. It's not just investment, though. We need to actually speak to clinicians who probably know best, and those who work in the NHS, what their ideas are, because often they know best, but they're not listened to. I think we've also got to use technology, AI, to see how that can help us going forward. We've got to make sure we reform some of the, I don't mean massive organisational changes like, previous Secretary of States have done, but reform some of the ways the NHS work. The key thing for me, which I think we don't talk about enough, is prevention. So you spent some time talking to me, I think because of your background, I suspect, about physical fitness, mental fitness, what we do. But just think about what we could do to prevent somebody becoming unwell in the first place in terms of young people at primary school, secondary school, using technology. Before the pandemic, who would have thought you'd be having an app where you could have a repeat order prescription? I can now email my GP, speak to my GP by phone, get a diagnosis and prescription. You would have dreamt about it before the pandemic. So if the pandemic can accelerate this innovation, why can't we do even more?
And virtual wards, perhaps, and maybe some health education in schools.
Well, let me give you an example of the issue of virtual wards. So my mum, had a fall not too long ago, and we were desperate to keep her out of hospital for long term. But the joy of social care now is you can keep her at home. A carer can come to home. It saves the NHS a shed load of money. You've heard about this awful phrase, inverted commas, bed blocking.
Yes.
Well, actually, my mum's happier at home. She's healthier at home.
Of course.
And it's cheaper her being at home. And so we've got to think about what we can do
Invest
to
in
try
community.
and get patients out of the hospitals where it's more expensive and at home.
And of course, we mustn't forget the wonderful work that is done every single minute of every single day in the NHS. We hear about the bad stories, but there are so many more good ones.
I've got members of my family and close friends who not just work in the NHS, but devote their lives to public service. And we always get, and you mentioned this in terms of crime, you always get the negative story reported. or the rogue doctor or rogue nurse reported, for every one of them, there's, thousands and thousands
Absolutely.
and thousands and thousands of really decent, hardworking, emergency workers who do a great job. The blue light services, the hospitals, practitioners, those who work in the community.
Well, I'm glad you said that because I'm prejudiced. But thank you so much for joining me.
Oh, it's been a joy.
Sadiq,
It's been a joy.
fantastic.
Take care,
Carry on the good work.
Take care, man. Appreciate it.
My thanks to the Mayor of London, Sir Sadiq Khan. Don't forget you can watch all my interviews on the Dr. Hilary Show YouTube page, including my conversation with Piers Morgan with his views on the NHS.
Look, I think about the NHS. I had a very, very dramatic and very alarming insight into the current state of it when my mother had a heart attack last November. Now, thankfully, she's fine now. Turned out to be a blocked artery, 99% blocked, and they fixed it with a stent, and she was back home in 2 days and got world-class treatment. But before she got there, she was diagnosed in one hospital in Sussex with a heart attack, then kept on a trolley there for 4 hours, then blue lit in an ambulance down to a major hospital down on the south coast. And she was then put on a trolley in the corridor at A&E for 7 hours. And there were 30 to 40 other people on trolleys in that corridor through that night.
You can watch that full interview online now. Don't forget, if you have any questions about your health, send me an email to ask@drhilaryjones.com. If there's something on your mind, I want to help. Make sure you watch the next episode and let's talk about what really matters to you. And for more information and show notes on all our programmes, go to drhilaryjones.com.